Dr. Phil Smith is an expert in a particularly challenging way, a particularly challenging area. My own doctor that I've gone to for a number of years is a friend, and their clinic implemented the type of technology that Phil is an expert in, computerized practitioner order entry, information entry systems, teaching doctors and healthcare professionals to use IT technology to better manage patient care, to better deliver their service. It's a big change, and we actually worked on this project from an organization development sense and perspective.
What is CPOE? And CPOE is Computerized Physician Order Entry or Provider Order Entry. It's also known as Prescriber Order Entry. So it's so new that we can't even decide what it's called. But it's actually having the people that write orders, rather than doing handwriting, and as Groucho Marx, the famous philosopher, would say, you bet your life on this when you're in the hospital, that we're actually going to get this right, okay? And if you look at it, the fifth order down actually has a question mark next to it. So the doctor didn't even know what he was writing, and that's pretty much the state of the art. So it's not about doctors prescribing, it's about the system that we use to communicate what the doctor intends. And the consequences of the current state, is that we have a doctor will write an order, put it in a chart, it goes on a stack of charts. A person called a unit clerk will open that chart up and proceed to take some of those orders off. And if there are medications, they will fax them up to the pharmacist, and the pharmacist will put them in. Now, what normally happens when you get something like this is we have a morning huddle. And the morning huddle is, what do you think Dr. Smith wants? I don't know. What do you think he wants? Well, why don't you call Dr. Smith? Have you seen Dr. Smith this morning? What do you think? And it goes on, and finally the unit clerk says, I've got the solution. I'm going to fax it to the pharmacist. Let them figure it out. And guess what happens in the pharmacy? They have another huddle. And it goes on and on and on, but think about the fact that this is a communication of initial orders of care. And I like to say in our health system, and I'll tell you a little bit about our health system more in a minute, but we run hospitals, not Hiltons or Marriotts, okay? And the reason, and the fact that we run hospitals, it's more important not that the patient's in a bed, but that the treatment is in the patient. So with CPOE, the doctor puts the order in, it's very clear on the front end, and we use something called clinical decision support, which is at the moment the order's written, if there's anything suspect of that order, such as an allergy, a drug interaction, too high dose, too low dose, or a clinical condition that medicine would not be the right thing to give, it immediately alerts the physician, and in 3 to 5 seconds, they can make a determination immediately whether that's a good choice. We have a huge organizational change of taking nurses and respiratory therapists and doctors who have been tied and married to paper systems and totally making the system electronic to have a paperless chart. And it's really amazing watching people go through this. And unfortunately, people think CPOE is about the technology, and it's really not. It's really about managing the change. And if you understand that, you'll be successful with it. But I'm seeing all these amateurs in the industry that bring in all these people with little propellers on their head and to do CPOE projects, but it's really about managing the change to the individuals. It's really a people project supported by technology, not a technology project. We try to give the hospitals a vision of what CPOE is, and you understand that every process in the hospital changes when we change how we communicate the order. So it's really about organizational change and process and people than it is about technology. But once we implement, it's really about stabilization, optimization, and then getting the benefits. So our 4 hours executive workshop, we do the typical 5 W's and the H. And I don't need to tell anyone in this room because you're all involved in change management at some point, but obviously the why has to be big. And if you can't get the why big, you might as well not even start. And then we assign change management champions for each of few threads, which I'm going to show you. And we want those people to be directors and vice presidents. We don't want them to be rank and file people. We want people who have influence in the organization. And here's the structure of our change management champion. So one person's over workflow, one's over stakeholder engagement. We have tools for each of these. I do this with a team of a medical director, a clinical director, a change management lead, and then 3 people that are IT, clinical IT, that support starting from 6 weeks prior to go live to 4 weeks after. Very small team, not a large amount of people, but this is our success factor, is going and assessing culture and then putting these champions to deal with specific things that we find in our assessment. We do a whole day of interviews for all the workshop attendees, and we're really dealing with attitudes, beliefs, and then business case and fears. And then we administer the Dennison survey to everyone at management and above. And typically a 200-bed hospital, this is about 46 people, can go as high as 98 or so on a hospital that's 400 or 500. And so we do management and above, and we slice and dice it looking at executives, directors, managers, clinical people and non-clinical people, and then we do the medical staff leadership, which are typically about 5 doctors, and we use the Dennison survey. And for the executives and the people on the team, we do standardized interviews and ask them 6 questions. What do you hope to achieve from this? What's your biggest fear? What do you see as obstacles? What do you see as your role in this? And what's your business case in your community for this? And when we do the Dennison survey, we've added some free text questions, which I actually use to validate. And I've been using the Dennison tool now since 2002 with CPOE projects. So currently I've had about 32 organizations I've done Dennison cultural surveys on. So have a pretty large number. And our free text question that gives us the most value is, what in your role here keeps you awake at night? And I have found that this question is very disarming, and people will really tell an honest answer to it. It's an anonymous survey, as you all know, and it's amazing because it's my greatest correlation between what we observe, what we get from the interviews, and what we get on the Dennison. Because like some organizations, I have found in the last 2 years, I've had 2 organizations that are just darn good survey takers. You ever have those people? They're just darn good survey takers. Everything's perfect. Everything's 5 out of 5, right? And so we use this to correlate, and with observations in the Dennison, we're able to do that. And then we ask them, is the organization heading in the right direction, and would you want to be a patient here? And that's very telling if the management team doesn't want to be a patient at the hospital, right? It's really hard to sell getting the patients if you don't want to be there. Then we compile this into a readiness assessment. We validate it with the executive team, then we validate it openly with the Dr. Phil show and the management team, and I walk around among them, show them the results of their survey, and we discuss their questions and the key points that we see, and we validate, this is what we see, is this right? And so far, we've batted 1,000 on that. The readiness assessment allows us to customize our approach in our change management plan so that we know where their pain points are. And if you look at our hospitals, we are already starting at a very good place. We are a faith-based organization. Our mission is extending the healing ministry of Christ. We have a 5-year vision statement that gets updated every 5 years. One of our vision statements is for every hospital to be in the top quartile nationally in patient safety, satisfaction, and quality as ranked by national measures. And we're on that journey. And getting CPOE deployed and also being available to survive in any economic changes in the healthcare industry, those are all part of our vision statements. And so we're very strong in mission and consistency. And guess where we always have problems as an organization? Our organization had no framework for change management. In fact, in healthcare IT or any IT, there's something called change control, which is I'm making a change to the system, we discuss it, I'm going to change the screen from blue to red, that's called change control. I still have people that think change management is change control, okay? Even the boss of my change management people. I mean, they just don't get it. But our Achilles heel as an organization is the ability to manage change. And so as bringing a change technology into the CPOE project, we're actually creating champion teams which can be used operationally for building a new hospital, starting a new service line, or anything that we're doing. So this is very, very critical that we realize in any organization, you've got some pain points.